Okie dokie. So now we will talk about blood pressure. So what is the definition of blood pressure? That's the force blood exerts against the inner walls of blood vessels. And again, when we talk about blood pressure, we're referring to arterial blood pressure in the arteries. Arterial blood pressure arises and falls according to a pattern established by the cardiac cycle. Systolic pressure, maximum arterial pressure reached during ventricular contraction, systole. So if you look at 120 over 80, that would be the first number, 120. Diastolic pressure is the minimum arterial pressure reached during ventricular relaxation. So that's the 80. Okay, so 120 over 80. 120 is the systolic blood pressure, and 80 is the diastolic pressure. A sphygmomanometer, it's hard to say, sphygmomanometer is used to measure arterial blood pressure. A BP of no greater than 120 over 80, so really we want it to be 119 over 79. Systolic and diastolic at rest is considered normal. Blood pressure decreases as distance from the left ventricle increases. So my blood pressure in my legs is going to be lower than my blood pressure in my arm because it's further away from the heart. The alternating expansion and recoil of a wall of an artery as the ventricles contract and relax can be felt at certain points. That's your pulse. So I can feel my carotid pulse here. I can feel my radial pulse here. We don't measure the pulse on a baby here because your hand will, maybe choke the baby. So we can hear the we use the arm here. We can use the brachial pulse on babies. Common pulse points are the radial, the carotid, the brachial, and then the femoral is down there. So here is, I'm sure you've seen this in the doctor's office. Maybe you've used one, sphygmomanometer. It's hard to say. Okay, so this you don't have to memorize, but blood pressure in adults, 19 plus years, normal. The AMA says less than 120 over 80. Normal used to be less than 130 over 85, but now it's getting lower and lower. I'm thinking lower and lower, so maybe they can put you on some blood pressure medications, right? But again, there's plenty of articles that say that high blood pressure is known as the silent killer, and that can lead to stroke and other complications later on. So make sure you get your blood pressure checked out. But again, the systolic can go up and down with stress, anxiety, emotion. But diastolic, which is at rest, that's the second number that we're concerned about. So a high normal could be 130 over 139 to 85 over 89. Severe hypertension would be greater than 210 over 120. Okay. Again, I don't need you to memorize all this, but I do need you to know what normal is. Blood pressure normally increases with age due to decreased extensibility of arteries, arteriosclerosis. Note extensibility can be improved with exercise. So exercise, exercise, exercise. So here's your 120 over 80, and that's in your aorta and your large arteries. But as you go further away, if you look at the superior vena cava, your blood pressure is very low. So the blood pressure is highest in the aorta and lowest in your vena cava. Arterial blood pressure depends on many factors, including cardiac output, blood volume, peripheral resistance, and blood viscosity. That's how thick it is. So cardiac output directly affects blood pressure. Now, cardiac output is stroke volume times heart rate. Stroke volume is the amount of blood discharged from each ventricle with each contraction. That's about 70 milliliters. So the heart rate, number of heart beats per minute, averages 72. So the average cardiac output, this is important for you to know, is 70 milliliters per beat times 7,200 beats, 72 beats per minute equals 5,040 milliliters per minute. So if stroke volume or heart rate increases, so does the cardiac output. Okay, so normal or the average cardiac output is about 5,040 milliliters per minute. Okay, and that's how we identify cardiac output as stroke volume times heart rate. So blood volume, sum of volumes of plasma and formula, varies with age, body size, and gender. The average adult blood volume is roughly 5 liters, 8% of your body weight. Blood pressure is directly proportional to blood volume. Factors that change blood volume also affect blood pressure. Hemorrhage or dehydration lowers the blood volume and blood pressure. So if you're dehydrated, your blood pressure can drop. You get up too quickly, boom, you pass out. So you have to be very careful. Now, peripheral resistance. So peripheral resistance, friction between blood and the walls of blood vessels is a force called peripheral resistance, hinders blood flow. Blood pressure has to overcome peripheral resistance in order to keep flowing. Factors that change peripheral resistance also affect blood pressure. As peripheral resistance increases, such as during sympathetic constriction of blood vessels, blood pressure increases too. All right, so sympathetic division, fight or flight, it's going to constrict and my blood pressure is going to go up. Vasoconstriction of arterioles cause blood to back up into the arteries, supplying the arterioles, which will increase the blood pressure. Dilation of blood vessels causes blood pressure to decrease. What causes dilation? Exercise, exercise, exercise. Long-term exercise, right? Because then the body says, excuse me, that you're getting a lot of blood through there. I'm probably going to need to increase the size. They've looked at cultures where their blood pressure is relatively low, but they've noticed that the cultures that just walk all day, the diameter of their blood vessels are really large because they're constantly working. Okay, so exercise will help. Viscosity, difficulty with which molecules in a fluid flow past each other. The greater the blood viscosity, the greater is its resistance to flow, and the greater the blood pressure. Okay, so if your blood is thicker, viscous, the greater its resistance and greater the blood pressure. So factors that influence blood pressure: blood volume increases. Your blood volume goes from 5 liters to 6 liters. Blood pressure is going to increase. If your heart rate increases, my blood pressure is going to increase. If my stroke volume increases, my blood pressure increases. If my blood viscosity increases, my blood pressure increases. If my peripheral resistance increases, my blood pressure increases. So this is a good question. You can say, hey, what are all the factors that can increase my blood pressure? Blood volume, heart rate, stroke volume, peripheral resistance, and blood viscosity. Now, who controls blood pressure? Okay, so blood pressure is determined by cardiac output and peripheral resistance. BP equals cardiac output times peripheral resistance. The body maintains normal blood pressure by adjusting cardiac output and peripheral resistance. Frank-Starling law of the heart is the relationship between cardiac muscle cell length and the force of contraction. As venous blood returns to the heart, the greater the length of the stretched cardiac muscle fibers, the stronger the ventricular contraction that will follow. A stronger contraction increases stroke volume and cardiac output. Therefore, the volume of blood that is pumped out of the heart is the same as the volume that enters. Okay. Cardiac output and peripheral resistance are partially controlled by baroreceptor reflexes. Baroreceptors sense changes in blood pressure located in the aortic arch and the carotid arteries. So here and here. The cardioinhibitory reflex, if arterial blood pressure increases, so if my blood pressure increases, the baroreceptors send impulses to the cardiac center of the medulla oblongata, which then sends parasympathetic impulses to the SA node to slow the heart rate, which results in a decrease in cardiac output and blood pressure. Then you have a cardioaccelerator reflex. If arterial blood pressure decreases, my blood pressure is low, the medulla oblongata sends sympathetic impulses to increase the heart rate. This increases cardiac output and enhance blood pressure. Again, I have a nice YouTube video link if you're more of a visual learner, which is right here, but I can't play it on this one. So there's a separate link. Okay. Control of blood pressure. Other factors such as emotional upset, exercise, and a rise in temperature can result in increased cardiac output and increased blood pressure. So emotion, exercise can increase that. Peripheral resistance also controls blood pressure. So changes in the arterial diameter change blood pressure. Sympathetic nerves change the diameter of arterioles in response to blood pressure changes. Blood vessels with smaller diameters provide greater resistance with blood flow. Vasodilation, right? You want the arteries to be nice and open and big, will decrease peripheral resistance and blood pressure. Vasoconstriction will increase peripheral resistance and blood pressure. Sympathetic stimulation causes vasoconstriction. The vasomotor center of the medulla oblongata can adjust the sympathetic impulses to smooth muscles and walls of arterioles, adjusting blood pressure. Certain chemicals can also affect peripheral resistance by affecting precapillary sphincters and smooth muscles overall. So if I have increased carbon dioxide and decreased oxygen and decreased pH will cause vasodilation in the tissues with high metabolic needs. Epinephrine and norepinephrine can cause vasoconstriction of many systemic vessels, which will increase peripheral resistance and blood pressure. Blood pressure decreases as the distance from the heart increases. Again, as you get further away from the heart, your blood pressure will go down. Blood flow through the venous system is only partially the result of heart action. It also depends on skeletal muscle contraction, so movement helps move that. So again, if I'm on a long plane ride, 16 hours to, let's say, Dubai or Singapore, well, I don't have a lot of muscle contraction, so the pool of blood can just stay there in my calves and I can get a blood clot. So that's why you want to get up every once in a while or pump your ankles while you're on a long flight. Contractions of skeletal muscle squeeze blood back up veins, one valve section at a time. Respiratory movements. Breathing create differences in the thoracic and abdominal pressures which draw blood back up the veins. Vasoconstriction returns blood to the heart. This is initiated by sympathetic reflexes when venous blood pressure is low. Remember, veins also act as a reservoir for blood in case of blood loss and decreased blood pressure. Vasoconstriction sends blood out of that reservoir. Now the arterial system. Let's do a separate one for this.